Everybody, we had to cut that video in half because we're just covering so much information for you guys. My last question, just before we got cut off, was, are there specific patient demographics? So can everyone be affected by sleep apnea? Is there just one specific group of people who could possibly be affected by sleep apnea? And go.
So yeah, general everyone might have a chance of experience that, but for people who are obesity or have high blood pressure, or just in general,
the risk is higher.
The risk is higher. So,
okay.
But I would say be careful of paying attention of what your body is telling you. Okay. That's the most important.
So listen to your body. Don't just chalk it up to something else. Don't just justify it. Get yourself checked out and make sure, because your health is the most important thing. All right, so let's see. How do they treat sleep apnea?
So far there's a most effective treatment. We call it CPAP machine. Mm-hmm. So it is a continuous positive air pressure it's like a mask and fits over your nose and mouth and gently pushing the air into your airway to keep it
open.
To keep it from collapse. Yeah.
Okay. All right. Cool. So if you do have sleep apnea and you know you do, or you're not sure that you do, but you're still exhibiting some of the signs, check with the doctor so that they can see if you do have sleep apnea, maybe do some sleep studies, and then possibly get a CPAP machine so that we can get that airway open so that you're sleeping safely. Mm-hmm. Okay, let's see. What else do we have to talk about here? We're just looking at our outline here.
So just closing here, pay attention.
Oh, yes. Closing notes. So we want to pay attention. We can't stress enough that we need to pay attention to our bodies. Mm-hmm. We as humans are such amazing creatures.
We're smart. Smart.
We are so smart. But the thing about being smart is that we're good at lying to ourselves. So pay attention to your body. If you think that something's wrong or you think that something's out of order, check with your doctor and make sure and communicate with them, or check with your pharmacist, pick our brains. A lot of times we are, I'm not a pharmacist, but come to your pharmacy and pick the pharmacist's brain. A lot of times we're way more accessible than the doctors are, and we work together with your doctor. So if we have a conversation with you about something like this, then we're definitely going to communicate it to your doctor so that they're aware, but that they're not going to have to, get you in for an appointment 2 or 3 weeks from when you're having these symptoms. Mm-hmm. So communicate with us here at the pharmacy so that we can relay the information to your doctor, so that we can work together as a community, as a healthcare community, to keep you healthy and happy.
We're very welcome.
We love helping you guys.
To answer your questions.
We're not just here for prescriptions. We're here for you. So let's see. Closing. We want to, if we do or are experiencing sleep apnea, we want to be sure and try and treat it as soon as possible, because it can have an impact on your cardiovascular health. And so if you are not treating your sleep apnea and it's negatively affecting your cardiovascular health, you're then setting yourself up